Hello guys, today we are going to clear few common concerns for patients who are undergoing endoscopy and colonoscopy. So first of all, endoscopy is a tube with a camera at the tip which is inserted through the mouth to visualize the throat, food pipe, stomach and initial few centimeters of the small intestine. Similarly, colonoscopy is a tube again but a longer tube with similarly camera at the tip which is inserted through the anus to examine the complete large intestine and few last centimeters of small intestine. Now the common concerns are, doctor, when my neighbor underwent an endoscopy, she felt that her entire food pipe was burnt, entire food pipe was damaged. So is it so, sir? Like can endoscopy and colonoscopy damage my intestine? It is a myth. The tube which we use is a very flexible tube and it never damages unless used with sustained or severe continuous force, which no one does that. And again, before doing an endoscopy, which is usually an office procedure means just come fasting, get it done and you can go back to your home. So what we usually do is we put an anesthetic or numbing spray so that our throat, the posterior portion or the backside portion of our mouth gets anesthetized, numb, and we do not feel such a tube going within the throat or the mouth, and it never damages the lining of the intestines. Similarly, colonoscopy is also done mostly in awake patients, or sometimes since it may be uncomfortable or unpleasant for few people, so it is done under a sedation. Next common concern is, so the same tube we will be using for the patient and me. So am I going to get infections or am I going to get cancers of the previous patient? It's a big no, because after using for one patient, before using for subsequent patient, we used to clean the endoscopy and colonoscopy multiple times with water, with the detergent agents, and also with an antiseptic or antibacterial or sterilizing agent called as Sidex. So that ensures almost 99.99% of viruses, spores, bacteria, everything is killed, and malignancies or cancers, they are not transmissible from one person to another person. So if you want to undergo an endoscopy and colonoscopy, go ahead if the indications are there without any fear, because it is not going to spread infection, it is not going to spread cancer, or it is not going to damage your intestines. Thank you.